Who is fooling who? Where is prevention?
Okay, so have you ever looked around and just wondered why, after decades of health campaigns telling us to eat better and exercise, we're not really getting any healthier? It's a super frustrating question, right? Well, today we're going to dig into exactly why that is, and spoiler alert, it's not your fault. I mean, just let that sink in for a second. It sounds completely ridiculous, doesn't it? You're basically setting that kid up to fail. But what's crazy is this is pretty much the exact playbook for our entire public health system. Yep, that's how it works. We're living in this massive contradiction that's just hiding in plain sight. We get all this advice while the world around us is actively pushing us to do the complete opposite. So, let's break that down. First up, let's talk about advice versus reality, because this is where the whole problem starts. Just look at this disconnect. The health campaigns tell us, hey, avoid sugar. But in reality, junk food is often the cheapest thing you can buy. They say avoid junk, but it's literally everywhere. Gas stations, checkout counters, you name it. They tell us to stay healthy, while we're getting hit with billions of dollars of marketing designed to make us crave the unhealthiest stuff. It is a completely lopsided fight. So this begs a really important question. What are we actually trying to fix here? Are we trying to fix people, or is the problem somewhere else entirely? And that leaves us right to the core idea of this whole explainer. The problem isn't your willpower. The problem is that the environment is a system. This is the one line you gotta remember. People don't wake up in the morning and decide to be unhealthy. We're all just following the path of least resistance. We choose what's easy, what's in front of us, and what we can afford. The system pretty much designs our choices for us before we even have a chance to think about them. So it all boils down to this really simple but incredibly powerful equation: behavior equals environment. See, it's not about how much self-control you have. It's about what your world is built for. And when the environment is perfectly designed to sell you junk food, guess what the default behavior is gonna be? And this is where you can really see the two sides clashing. On one side, you've got the health sector, trying its best to drive awareness. They're giving us information, telling us what we should do. But on the other side, you've got the market, which is spending way more money to drive temptation. And the hard truth is, you just can't. A little brochure or a TV ad doesn't stand a chance against a multi-billion-dollar system that is engineered to make you give in. Awareness is completely and totally outgunned by temptation. So we'll get right down to it. If the unhealthy choice is cheaper, easier to see, and more convenient to get, that's what people are going to choose. And that's not a moral failure on their part. It's just a predictable, logical outcome of the system we've all built. Okay, so this all sounds kind of hopeless, right? But here's the good news. If we see this as a failure of design, not a failure of people, then it becomes an opportunity to rebuild the whole thing. So how do we actually do it? Well, there are three really powerful levers we can pull. First, availability. We need to control what's sold and where it's sold. Second, pricing. We have to make the healthy choice the easy, affordable choice. And third, visibility. We need to make the healthiest options the most prominent ones, right there at eye level. These aren't just vague ideas. These are actual design choices we can make. And this really hammers home that central idea we've been talking about. If you make the healthy choice the most available choice, it will naturally become the most chosen one. You change the environment, and the behavior changes almost automatically. Which brings us to the real endgame here. The true goal of public health shouldn't just be about giving advice. It should be about making health automatic. And this is the mission. The real job of public health isn't to nag us or tell us what to do. It's to design our schools, our supermarkets, our cities in a way that the healthy choice is the default choice. The easy one, the one you don't even have to think about. So the next time you hear about a new health campaign, ask yourself this: is this just more advice, or is it actually changing the system? Because real prevention, it's not found in a pamphlet. It's found in the design of the world around us.
Who is fooling who? Where is prevention?